Using simulation-based education, one can reproduce a medical scenario and a learning environment where consideration for medical safety and care for patients can be in the forefront. International University of Health and Welfare, IUHW, has established a high-performance simulation center at its Narita campus in order to train medical professionals in responding to a variety of clinical situations. IUHW Medical Education Simulation Center, also known as SCOPE, allows for the specific training and education needs of medical students, residents, and specialists at the various stages of their careers. The Simulation Center is the largest in the world and boasts an area of 5,338 square meters. SCOPE reproduces the environment required for clinical education, including examination rooms and emergency rooms. Through simulation training corresponding to various clinical scenarios, students can learn and refine their medical knowledge, clinical skills, and professional attitudes. Regardless of the type or severity of illness or injury sustained, the ER accepts all emergency patients. The doctors working in this environment need to be proficient in providing initial medical treatment. In the ER simulation room, students learn how to manage acute illness or injury using advanced patient simulators. These simulators can be modified to correspond with the various clinical statuses of patients at the different stages of their illnesses. In the OR simulation room, equipment including operating table, shadowless light, anesthesia machines, and biological information monitors are arranged to reproduce the operation rooms of IUHW's affiliated hospitals. This human patient simulator can be connected to an anesthesia machine, and the vital signs can be observed changing in response to medication and treatment. In the operations simulation room, students learn the physiological and pathological changes of patients undergoing surgery. Additionally, the advanced functions of the simulator can be used in courses such as pharmacology. This allows students to observe the pattern of change in the vital signs of patients when treated with various drugs. Facilities in the ICU simulation room meet institutional standards of an intensive care unit. The patient simulator can demonstrate a variety of conditions, and students can learn and refine their knowledge and skills in intensive care or post-operative management of patients. In addition, a high-performance simulator is equipped so that students can learn the management of childbirth delivery and how to deal with perinatal abnormalities. The room for basic life support training is about 500 square meters. Taking advantage of this size, up to 150 students can have a training session simultaneously with the aid of 50 mannequins. At the School of Medicine, cardiopulmonary resuscitation training using Japanese-English bilingual AED is performed at the freshman orientation. As part of a regional collaboration with Narita City Fire Department, students, faculty, and staff at Narita campus also undergo the training. In the BLS room, facilities are available to allow for disaster medical training. In the simulated hospital, there are 4 bedrooms and private rooms which have the exact same equipment as those found in hospitals. In these rooms, students learn the management of the patients at all life stages. We have children and baby mannequins, as well as adult mannequins. Also, multi-occupational collaboration and team medical care programs are taught in this room. We have prepared 22 examination rooms for the medical interview and physical examination training to ensure our students acquire the most fundamental clinical skills and attitudes as a doctor. This spacious layout has the great advantage of being able to conduct OSCE tests, objective structured clinical examination tests, before and after clinical clerkship. IUHW gives high priority to medical interview skills education to ensure active listening to patients and their families with empathy. Medical interview training is commenced immediately after entering our medical school. Medical students learn communication skills by performing role-play scenarios. These skills are examined during their interview with the simulated patients that live in Narita City. Students also practice basic physical examination skills in this room. A debriefing session is conducted for reflection after performance for better learning in simulation-based learning. Scope has sufficient numbers of debriefing rooms and conference rooms for all faculty. Faculty and other students can watch the performance via a one-way mirror. The simulation exercises can be recorded and stored for debriefing and educational purposes. Scope is equipped with almost all of the simulators utilized for medical professional training. We have significant numbers of task trainers for the students' individual practice. We also prepare high-functional patient simulators that can reproduce complex biological reactions and program essential clinical scenarios for team-based learning. In addition, medical students acquire clinical skills relevant to all patients through simulation training with mannequins such as infants, toddlers, children, adults, pregnant women, and others. For physical examination skills training, we have a sufficient number of simulators for basic clinical procedures such as heart sounds, breathing sounds, head, neck, and abdominal examination, blood collection, and central venous catheter insertion. Scope, the largest simulation center in the world, is designed to demonstrate the most effective simulation-based medical education. At our university, simulation education has been introduced in many classes. Through education at Scope, IUHW will train medical professionals who can maximize his or her ability to respond in every situation.